Welcome to the deep dive. You're joining us today as we try to get a solid handle on a treatment that might sound a little out there, but is actually used for some really tough wounds.
Hyperbaric oxygen therapy,
Yeah.
right? Or HBO.
Exactly, HBO. We want to unpack why it's considered for these complex wounds, particularly, those really stubborn diabetic foot ulcers.
Yeah, and the goal is to make sense of it without drowning in medical jargon.
Think of this as your quick guide to getting informed on the core ideas.
Sounds good, because when you first hear breathing pure oxygen in a pressurized room, it does sound pretty futuristic.
It really does.
But it's a genuine medical therapy, and the thinking behind it makes a lot of sense once you understand the hurdles these wounds face.
Okay, so let's get right to the heart of it then. You've got a wound, maybe a diabetic foot ulcer, and it's just stuck, not healing. Why would putting someone in this high-pressure, high-oxygen chamber help?
Well, often the fundamental problem, the biggest hurdle with complex wounds like DFUs, is poor blood flow. Simple as that,
Yeah,
almost.
it's poor circulation.
Right. And if the blood isn't flowing well, the tissues trying to repair themselves just aren't getting enough oxygen. You need oxygen. It's like essential fuel for healing.
Makes sense, like trying to build a house without enough bricks or wood. So how bad is this oxygen shortage usually?
It can be pretty significant. One critical process in healing is growing new, tiny blood vessels. The term is neovascularization.
Right, like new plumbing for the area.
Exactly. And that process really struggles when tissue oxygen levels are consistently very low. We measure this in millimeters of mercury, mmHg. If those levels drop to, say, between 7 and 15 mmHg, it's really tough for new vessels to form.
And in a non-healing wound.
In the sort of dead central part of a chronic wound, the oxygen pressure might be only around that 15 mmHg mark, very low.
Wow.
But here's where HBO comes in. Put someone in a chamber at about 2.5 times normal atmospheric pressure, that's 2.5 ATA, for maybe 2 hours.
Yeah.
And that oxygen pressure in the wound tissue can jump up to around 100 mmHg.
From 15 to 100, that's a massive increase.
It's a huge physiological change.
So does this mean that even if the main arteries going to the foot seem okay, like tests show decent blood flow in the bigger vessels,
Yes.
the actual oxygen getting to the wound tissue at the micro level can still be the real problem in diabetes?
That's precisely it. Sometimes doctors check the larger vessels, segmental pressures, toe pressures, and they look okay-ish.
Right.
But then they measure oxygen right there in the skin tissue using something called TCPO2, transcutaneous oxygen pressure, and they find it's really low, often below 30 mmHg.
And below 30 is bad news for healing.
Yeah, a TCPO2 below 30 mmHg is a strong indicator that the wound is unlikely to heal without some kind of intervention, like HBO.
Okay, so HBO is basically designed to force more oxygen into those starved tissues. How does the pressure actually achieve that? Is it just pushing it harder?
It's more about physics, really. Under normal air pressure, most oxygen is carried by hemoglobin in our red blood cells. But under hyperbaric pressure, much, much more oxygen dissolves directly into the liquid part of the plasma.
Oh, interesting. Not just relying on the red blood cells.
Correct. The amount dissolved in plasma skyrockets. Theoretically, at high enough pressures, the plasma alone could carry enough dissolved oxygen to meet the body's basic needs, even without hemoglobin, though that's an extreme example.
That's incredible. So you're supercharging the plasma's oxygen carrying capacity?
You got it. And when you breathe this pure pressurized oxygen, the usual drop in oxygen pressure as blood squeezes through the tiny capillaries, it's much less steep.
So more oxygen stays in the blood further down the line.
Yes, and this extra dissolved oxygen can then easily diffuse out of the plasma into the surrounding tissues. It can reach areas where circulation is so poor that red blood cells might struggle to get there or unload their oxygen effectively.
Like a secondary delivery system.
It's a very effective secondary delivery system, exactly.
Okay, so we're flooding the area with oxygen. What does that oxygen do once it gets there? What's happening at the cellular level to promote healing?
All right, so wound healing is this complex, orchestrated sequence. First, platelets and fibrin form a clot. Then various cells move in.
A repair crew.
Yeah, you've got fibroblasts, macrophages, endothelial cells. They clear debris, build new structure like collagen, and create those new blood vessels we talked about.
And all this activity takes energy.
A lot of energy. And generating that energy efficiently requires oxygen. Think of it like a construction site. You need power to run the tools and machinery. Oxygen is the power source for these cellular processes.
So without enough oxygen, the whole repair operation just grinds to a halt.
Pretty much. Or it proceeds very slowly and inefficiently. For instance, fibroblasts, the cells making collagen, which is crucial for skin strength and structure, they absolutely need good oxygen levels to work properly.
And HBO helps them.
Yes, studies suggest HBO can actually stimulate fibroblasts to multiply and also encourage epithelial cells, the skin surface cells, to grow, which is key for closing the wound. Interestingly, some studies found that hyperbarically oxygenated wounds might heal differently, maybe more efficiently, not just faster.
Okay, more oxygen sounds good. But you hear about potential downsides sometimes. What about this ischemia reperfusion injury? Could suddenly flooding an oxygen-starved area cause damage?
That's a really important point, and it was definitely a concern. Ischemia reperfusion, or IR injury, is a real phenomenon. When blood flow returns to tissue that's been deprived of oxygen, ischemic, it can paradoxically cause more damage.
Wow.
Part of the mechanism involves a burst of harmful molecules called free radicals. So the initial worry was, if we flood the tissue with more oxygen during reperfusion using HBO, are we going to make that free radical damage even worse?
Right. Could the treatment backfire?
It was a valid question, but intriguingly, research has generally shown the opposite. HBO actually seems to antagonize or counteract the negative effects of IR injury in many tissues.
Really? How does that work?
Well, for example, studies in animal models, like rat skin flaps, showed that giving HBO right after restoring blood flow actually improved tissue survival and microvascular blood flow compared to controls that didn't get HBO.
So it helped protect the tissue.
Exactly. And one way it might do this is by making certain immune cells, called neutrophils, less sticky. Normally, in IR injury, neutrophils stick to the blood vessel walls and contribute to the inflammation and damage. HBO seems to reduce the stickiness, possibly by interfering with an adhesion molecule on neutrophils called CD18. So it helps calm down that damaging inflammatory response.
That's fascinating.
Yeah.
So it might actually protect against that reperfusion injury risk. Okay, let's zoom in on diabetic foot ulcers again, since they're such a common reason for using HBO. What's the specific evidence there?
For DFUs, HBO is often considered a key part of the treatment plan in many specialized wound centers, especially for the more severe cases.
Is it dependent on blood sugar control?
Interestingly, no. It seems the patient's response to HBO isn't really affected by their blood sugar levels before starting therapy, so you don't necessarily need to delay starting HBO just to get perfect glucose control first.
That's good news.
Yeah.
So what kind of DFUs benefit most?
Looking at the evidence, like systematic reviews, HBO seems most beneficial for preventing major amputations and promoting complete healing in more severe ulcers, typically classified as Wagner grade 3 or higher.
Grade 3 or higher. Those are deeper ones, often involving bone or deep infection.
Yes, exactly. And it's typically used after the wound has been surgically cleaned out, debrided, or if the ulcer just hasn't improved after, say, 30 days or more of good standard wound care.
What about less severe ulcers, Wagner grade 1 or 2?
For those, the current evidence supporting HBO is generally considered insufficient. It seems most effective for the really complex, challenging cases.
Got it. Any other examples?
Well, there are case reports too. I recall one about HBO being part of a successful treatment for a patient with a really persistent pelvic bone infection, osteomyelitis, that developed after a fracture. So it's used in other complex infection scenarios too.
Okay. Now, infection is a huge issue in these wounds. Does HBO help fight the bacteria directly?
It can, yes. That's another important aspect. HBO can directly inhibit the growth of certain bacteria, particularly anaerobes.
Anaerobes, those are the ones that hate oxygen.
Precisely. They thrive in low oxygen environments, exactly like you find deep in a poorly perfused wound. HBO makes the environment toxic for them.
So it helps clear out those specific bad guys.
It can. And there's also evidence suggesting oxygen might boost the effectiveness of certain antibiotics.
How so?
For example, with a class called aminoglycosides, HBO might help them work better or prolong their effect after the drug exposure stops what's called the post-antibiotic effect.
But is that always predictable?
Well, that's a good caution. What happens in a lab test tube doesn't always translate perfectly to a living person or animal. For instance, theoretically, HBO might interfere with an antibiotic like metronidazole, but that wasn't actually seen in one animal study of sepsis. So it's complex.
So it might help antibiotics, but it's not guaranteed.
Right. But beyond directly affecting bacteria or antibiotics, HBO also seems to enhance the body's own infection-fighting mechanisms. It helps our immune cells work better.
Ah, so it boosts our natural defenses too.
Exactly. Which contributes to better overall outcomes in infected wounds.
This has been really insightful. So
Yeah.
if we were to boil it down, What's the main takeaway message about HBO for these difficult wounds?
I think the key point is this. For complex wounds, especially like diabetic foot ulcers, where that lack of oxygen is a major barrier to healing, HBO offers a specific way to tackle that core problem.
By flooding the tissues with oxygen.
Right. By dramatically increasing the oxygen dissolved in the blood, it gets that vital element delivered to damaged tissues. It supports the energy-hungry healing processes, and it might even help other treatments, like antibiotics, work better.
It definitely sounds like a valuable tool, at least in the right situations.
It absolutely can be, but, it's important to remember it's not a magic bullet. The science supports its use in specific circumstances like those severe debrided DFUs, but it's always part of a bigger, comprehensive wound care plan.
That's a crucial caveat. It's one tool among many.
Precisely.
Okay, great.
Yeah.
So as we wrap up this deep dive, maybe something for our listeners to think about. Given how absolutely critical oxygen is for healing, just fundamentally,
Yeah.
what other kinds of medical conditions might benefit from a targeted boost in oxygen delivery like this? And on the flip side, what limitations or potential risks always need to be considered? Definitely some food for thought there. Thanks for exploring this with us today on The Deep Dive.